I'm very happy to welcome everyone in this webinar and our speakers in particular, of course. Okay, Tino, you have in action indeed. So very happy to welcome you all in this webinar. I am Marc Lange, the General Secretary of EHTEL. As you can see from this screen, EHTEL is one of the organizers of this webinar together with Digital Europe. EHTEL, for those who are not familiar with our organization, is an association, a multi-stakeholder as a platform aiming at creating collaborations between all actors in the field of digital health. And Digital Europe is another association, another European association, which is representing the IT industry at European level, while EHTEL is focusing on digital health. Digital Europe has a much broader scope, but has, of course, in digital health on its agenda. Today, digital health is unavoidable, I would say, for all those working connected to the healthcare environment. So, but no, but fine. No, please, you go too fast, Tino. Please, back. Happy also to mention another organizer. Let's keep on the first one, please, Tino. Another organizer, yes, this one where you see Digital Health Uptake, which is a project, which is the project, which is who is really the umbrella of this webinar. Digital Health Uptake, as you can see from these slides, financed by the European Union. So what is, and then you can move to the next slide, Tino, please. What is Digital Health Uptake? Why is this project needed today? I would say that we believe EHTEL, Digital Europe, and all the other members of the consortium who are part of this, all the other organizations who are part of this consortium, we all believe that Digital Health Uptake is an indispensable project. Why? Simply because we can all recognize that today the technology for digital health is there, but today clinical evidence for including digital health in care processes is there for a number of use cases. We can also recognize all that today healthcare needs digital health, and that even the technology and the solutions using digital health solutions becomes affordable. The economic efficiency of digital health becomes obvious. Still, a lot of work still to be done, but so a lot of elements, all these building blocks are today now on the table. And what is now really important is to ensure that digital health solutions are really deployed at a large scale in the field for everyone who needs and every healthcare systems who need it. And that's really the scope and the importance of Digital Health Uptake, trying to help actors in the field of digital health to deploy at a large scale their solution. So that's, and you see here on the slides, the three objectives of the project being a bit stated a bit more formal. Next slide, please, Tino. And how is Digital Health Uptake working on this support? Different instruments have been put in place. The first one is certainly what we call the Digital Health Uptake Radar, which is a repository of good practices that you can find on the website of the project itself, where doers, implementers of digital health solutions are invited to enter data describing their solutions, and in particular describing their solution as far as they are mature. That's really the focus of this repository. Describing, entering these data so that they are made known, and so that the project itself can put some of them, those we retain, put them under the spotlight to help to raise awareness about what has been achieved so far. This is one of these first instruments that DHU, to make it short, Digital Health Uptake, DHU is deploying. Next slide, please. But solutions, but good practices, that's definitely not enough. It's also about people. And of course, that's why DHU is also willing to facilitate, willing to support, willing to animate a community, a knowledge community, so a community of all those who are working in the deployment of digital health solution. And certainly this webinar is one of the first webinar aiming at developing this community and aiming at giving some, shaping it and giving it some materialization. So next slide, please, Tino. And last but not least, the third instrument that the DHU is deploying is what we call an accelerator, which in fact is a set of tools, a set of instruments, all aiming at putting things into practice, helping people, helping organizations to deploy digital health solutions in practice. We will find there under this label a set of tools and methods for upscaling digital health solutions. We will also find the organization of trainings activities, as well as on technical assistance activities and other initiatives to expand the digital health ecosystem. These are instruments that will contribute to accelerate the DHU, to accelerate to materialize the DHU and accelerate the large-scale deployment of digital health solutions. Before entering into the webinar, which is very much focusing today on tools and on methods for large-scale deployment from a particular perspective, the perspective of the supply side, as opposed to the demand side. But before entering into the core of this, we would like also to draw your attention on a call for twinning that has been launched before the summer, and that is today being extended until mid of October, 13th of October, which will then give opportunities to the demand side in particular, so to organizations willing to deploy digital health solutions to work together, to twin, to work together, to learn from each other on how to best upscale digital health solutions. As you can see, this call for twinning is not only simply putting people in contact to each other, but also will provide some funding to help this to happen. Next slide, Tino. And last but not least, to close my introduction, and then I will pass the floor to our chair. I would like also, as part of this knowledge community, I would like also to draw your attention on this event that EHTEL is organizing on the 29th of November. This time will be an in-person event in Ghent, as you can see, which is then the annual EHTEL symposium. And why are we mentioning this here? Because it's of course also about digital health and about upscaling digital health. So it is also a contribution to building and developing the knowledge community of DHU. But in the same time, it will put this question on upscaling digital health solution into a broader context. With data, with artificial intelligence, and in particular generative AI, and with a number of other topics, governance, and I could mention some others. So putting the question of upscaling solutions, putting them into a global, into a broader perspective. So, but with this, I will stop my introduction and my welcome intervention, and will pass the floor to Tino, who will be chairing this webinar. The floor is yours. Thank you. Thank you.
Thank you, Marc, and good afternoon to everyone. I want to ask you, Marc, if we can upgrade Rita as a presenter. She was asking me to do so, but I cannot do with the full screen. So, objectives of this webinar are three. We want to present the Digital Health Uptake framework of methods and tools. We will share this with you now, but we wanted to listen from digital health innovators, those that are from the industry, and learn how they are applying or addressing the challenges that they face when they are trying to implement digital health, or they are trying to scale up to a large extent. And also, as an objective of the session is to identify new methods and tools. So we will share now what we have done at this moment. But just a brief introduction of the speakers we'll have today. We will be pleased to listen from Katarzyna Markiewicz from Philips, Rita Campos from F6S, and Dalibor Frtunik from SORSIX. And we are together with Marc and Michael Strübin from Digital Europe. So if we go to this first section where we want to share with you the work that we have done in digital health uptake, particularly in this section of the accelerator and the work on mapping the available tools that can support the scale up of digital health. We have done work of consolidating methods and tools that came from 3 different sources. One of the sources, and I'm invited here again to provide new methods and tools through the Digital Health Uptake Radar, which is an online platform that you can find in our website. We also did this search of methods and tools, and we conducted different interviews with different players of the digital health landscape. And the initial collection was 20 methods and tools. The question there was how we could classify them in a way that makes sense for those that are both on the supply side, in the demand side, or what we call the enabler side, those that are facilitating the adoption of digital health, how they can be guided in this process. So the first element that we did was to focus our search on the implementation process. You can see at the bottom of the slide, there are the 2 phases, the ideation process and the implementation process. We wanted to focus not on ideas and prototypes, but already in pilots, and particularly the key points of the decision maker adoption, the end user understood as people, patients, and healthcare professionals uptake, and then how this digital health that have gone through the pilot and that are already adopted can be scaled up and at the maximum extent to be deployed at large scale, meaning nation or regional wide or even cross-border. So we're focusing on the implementation process. As you can imagine, the process is many ideas, less pilots, and few large-scale deployments. So we want to assist in this process to provide useful tools that can help to navigate the process from pilot to large-scale deployment. So the 20 methods and tools were classified in 7 categories. These 7 categories are along this process of ideation and implementation, touching different phases, and we have consolidate them in these 7 categories. The first one is on design of solutions. The second on business modeling. This is going already towards the implementation process. We identify risk stratification tools that were useful for compliance to standards and norms. Many tools on maturity and readiness levels. Few on digital skills development, and some on value assessment tools that can be used either at the beginning to show the value of the digital health solution, or when you want to scale it up in a country. So there are many examples, but I want to illustrate this with 3 concrete examples. In this process, we were interviewing digital health champions more from the demand side, those that are adopting and they are scaling up from healthcare provider organizations or governments. And we wanted to know more about what the IT industry, digital health industry is using to navigate this process, probably more on the first phases, but to open absolutely the range of tools, we have invited, and this was the rationale of contacting the speakers, representatives of large companies like Philips, mid-sized companies like SORSIX, or the world of startups represented by the startup platform F6S. Let me give you these 3 examples. Let's go for the first one on design of solutions. You are perfectly aware of different methodologies that are addressing user-centered design, like design thinking in the ideation process, and specifically the blueprint personas, that is a set of profiles, archetypes that can be used by digital health companies when they are defining their use cases in order to develop user-friendly interfaces that has been proved as one of the key elements to get the early adoption of a digital health solution. On a different category, maturity and readiness levels, we spotlight here the Sirocco maturity model. This is a multidimensional self-assessment tool that helps different players in a particular area, region, or country to agree on which are the elements that have to be improved in order to get better care integration between the different healthcare providers, including social care. So it's a consensus building tool that is available online and has been applied in more than 12 European countries with many assessments, and even overseas in other continents like in the States or in Australia. You can have a full profile of this tool in the Digital Health Uptake Radar. Following that link or just browsing on the website, the catalog of methods and tools, but also digital health solutions that the Digital Health Uptake Radar contains. Third example, practical. I mentioned before that value assessment tools are both applicable at the beginning of the journey or when you are aiming to scale up. Providing evidence about the cost effectiveness can be a prerequisite to access digital health markets, but it's also a good tool to convince those that are about to make decisions to adopt a digital health solution. To do cost effectiveness, of course, it's not an easy task, but there are tools that help to provide, to develop this economic evaluation. And we have here highlighted two, MAFEIT, that was developed in the context of the European Innovation Partnership, and another tool that was developed also in another European project, not in healthcare, but has been applied also in healthcare. That is the tool called Assist for e-service deployment. Both they are guiding the user to perform an impact assessment and specifically cost effectiveness analysis. So these are three examples of tools in these three categories that can be used in this journey from pilot to large-scale deployment. But what is next in this work that we are doing? The project Digital Health Uptake will last 1 more year. We continue to collect available tools, and that's why we launched this call for contributions. If you have a method and tool and that you want to put it in under the radar, you can do it through the website. With all this information that we are gathering, we are going to produce reports that are digest of these findings that will print and display all the tools along the journey from ideation to implementation. And also a next step that we will do at the end of this year is we will launch a call for trainings. Those that are eligible will be those that have reported their methods and tools in the Digital Health Uptake Radar. And these trainings will be trainings of a specific method or tool in support of European reference sites and the digital health uptake twinnings that Marc has presented before. So this is, in a nutshell, the work we are doing to map out all methods and tools that can help digital health implementers from both sides, supply and demand, in Europe. And now we want to listen more from the industry, the supply side. And for this, we have 3 exceptional presenters: Katarzyna Markiewicz from Philips, Dalibor Frtunik from SORSIX, and Rita Campos from F6S, and representing, in fact, all sizes of companies that face probably different challenges when they address markets at local, regional, national, and European level, even globally. So with this, I would like to invite Katarzyna Markiewicz to provide her first intervention in this webinar, and I will share your slides, Katarzyna. You can tell me next when you want to pass the slides. Katarzyna, welcome to the webinar, and the floor is yours.
Thank you. Thank you, Tino, for a very nice introduction, and thank you for introducing me to this webinar. I think this is very interesting topic, very important one, because we know that digital health was having a bit slower uptake first, but then, of course, pandemic accelerated digital health development to the level where we started to be very conscious about the way we actually develop digital health. So I think it's a good time to look into different tools and strategies. So today I'm going to talk about the strategies to provide the healthcare value, some of the strategies that we use in Philips. And of course, this is just a sample, but I think it can give you some understanding on how, companies like Philips are looking into digital health. So if we can go to the next slide. So first of all, we know, this is more of a obvious slide, but healthcare is such a different industry compared to the other ones. So realizing this at the start of the journey, I think, is the most important thing that all the developers, all the digital health manufacturers have to do. So healthcare is very strictly regulated. Human is at the center, or at least should be at the center, and should always be in the loop of the development. And the decision making is influenced by many stakeholders from many different entities. When it comes to digital health, it's also a little bit different than, let's say, the mainstream device development that we are used to. So this is very much an ecosystem game. So we are talking about data access, we are talking about AI algorithms, we are talking about many different ecosystem play that stakeholders that can play in this ecosystem. And finally, the data collection from patients has challenges and limitations, and we know that we need data to create proper digital health offerings. So if we can go to the next slide. So first of all, understanding the market is the key. And often what can happen is that, we are focusing so much on technology and we have this clinical need and we believe that this brings value, but then we stop looking into the market, and market can change very dynamically. So as I mentioned, the pandemic really accelerated adoption of digital health. So we know that the telehealth has skyrocketed. We know that the virtual collaborations really extended the reach of how specialists can provide care to the patients. And also the data sharing and collaboration across different stakeholders increased. But what is also important is not only to understand what is currently happening, but to try to understand a little bit, okay, so what do we then expect in the future? Because the solution, the offering you are working on today will also have to bring value and fit into the future roadmap. So what is the future of digital health? We know that the direction is to become more personalized. So let's say the digital health that is really connected to the personalized individual needs and preferences. We know that it's connected, and we know that it's integrated. So connected and integrated, those are two very important things, because in the end, we want to have care teams that will be connected to the patient, that will have seamless integration of view from many different systems. And then we can go to the next slide. So in Philips, we believe that addressing customer needs is the biggest value of what the digital health can bring. And we look into the customer needs from the perspective of the quadruple aim. So we are trying to understand, if we develop, digital health offering, how will this improve the health outcomes of the patient? How will this improve the patient experience and the staff experience, also very important? And finally, how will this lower the costs? But then, if we can go on next, then also what is extremely important is that, you know, we can use the quadruple aim as kind of a framework to decide what kind of, you know, claims we would like to address, and then the next step is to really support these claims with evidence. So it's not only about creating nice technology and giving this to the doctors and saying, hey, this will really improve your patient's life. You really have to come with hard evidence and say, okay, by this and this time, you know, 25% of your patients will actually move from, let's say, a simple example, from the diabetes stage to pre-diabetes stage. So if we can go next. So I mentioned that human is in the center of the digital health, and it's very important to support human experience with need-driven innovation. So in Philips, we believe a lot in human-centered design. So everything that we are working on always has a person inside, being a patient, health consumer, or healthcare professional. And then the seamless workflow integration. So I mentioned this before, whatever we are working on, it has to fit seamlessly into clinical workflows. And training and education. We often think that just giving technology to the doctors or patients is enough. It often isn't, especially when it comes to, you know, AI-enabled solutions. And we can do all this through collaborative ecosystems. So not only long-term strategic partnerships with different clinical sites, clinical partnerships, but also how do we work together with other companies? How do we integrate third-party offerings into what we are trying to develop or what we are offering? And then a big topic, of course, digital marketplaces. So how do we make our offerings, but also the third-party providers offerings accessible to bigger amount of customers? And that can, of course, be connected to via common platforms. And very important, also, we have to understand the technology we are using and the barriers, because often, as I said, the technology, it's in demand, but then if we don't really understand what are the gaps that we will have to address, we can have a very nice idea, but we will just be stuck somewhere and on the way. So for example, when it comes to data and AI, which is really the blood flow of the digital health offerings, we have to deal with data access. We have to understand, are we even able to develop this? Are we even able to get the data? Trust. We have generative AI hype right now. How do you create trust around the AI proposition? And, you know, how do you overcome this issue of black box AI? And then how do you scale? So how do you involve people? How do you enable the governance, the partnerships? And if we go to the next one. So for example, and I personally really like this example. So Philips really believes in promoting safe, secure, and responsible use of data and AI. So we have the data and AI principles where, you know, every solution, every offering we are developing, we are always trying to think, okay, so from the data side, is it secure? Is the privacy of our patients the top of the mind? What are the benefits to customer, to patients, to society? And then very important on the AI principles, what is the health and the well-being that we are addressing? What is the human oversight? I mean, with generative AI, this is extremely important as well. Then what is the robustness of the algorithms? What is the fairness? You know, how do we avoid bias and discrimination? And the transparency. Thank you.
Perfect. Thank you very much, Katarzyna. I think you are raising very important points. I would like to ask the audience if they have questions to place them in the chat box, that we will pick them during the discussion with all the presenters. Now I would like to invite, and thank you again, Katarzyna, for your great presentation. I would like to invite Dalibor Frtunik from SORSIX to address the second presentation. Dalibor, good morning for you. I know that you are in the States at the moment. Yes. Welcome to the session. Please introduce yourself and explain us specifically this large-scale deployment. And here I call the attention that your case illustrates the end of this implementation process, and this was the reason to invite you to the webinar. Welcome, Dalibor.
Thank you, Tino, and thank you, EHTEL, generally for inviting me. So my name is Dalibor. I'm the CEO of SORSIX. We are a health tech company. Strictly speaking, we are headquartered in Australia, in Sydney, but we have a very large development office in Skopje, Macedonia, and some of our principals are there. We have this kind of, global view as a result. Healthcare has similarities and differences between these jurisdictions. What I'm going to talk about today is a deployment we did a few years ago. So and maybe Tino, skip to the next slide. I'll kind of tell the story as we go through. I won't go through all of the points necessarily. So the context of this is our company in 2012 deployed a solution, initially relatively simple, which is kind of our core product. It is called Pinga, but national deployments and some of our larger private customers brand it, like white label it essentially. So this product is a combination EHR and workflow platform. You can think of it, we call it a health operating system. Basically, it unifies a whole host of standard functions that are required in healthcare under one tent, and then integrates with a whole bunch of third-party solutions via APIs. And we do integration out and in, if you like. Others consume our APIs, and we consume theirs. So that project in Macedonia was a huge success, and there was a similar project in Serbia that went to tender in 2015. The project began in 2016. Over 3 months, we localized the Pinga deployment, essentially, that we had in Macedonia, because they wanted to start from a relatively mature base. And then we began a rollout process, which took 6 months, which is a very short time, to roll out this tool across the entire country. Just for context, Serbia has about 8 million citizens and something like 80,000 clinical users. I think that number has crept slightly higher since we deployed it. But that's kind of the rough scale of the system here. And something like 33,000 what we call endpoints. Endpoints might be a specific clinician who treats patients, a radiological device, a bed, all that sort of thing. So that's the kind of context of this project. And what this project is, Tino, maybe skip to the next slide. Yeah. So the system we have put in is a full electronic record for all citizens of this country. Essentially, it is owned by and the responsibility of the Ministry of Health, or like the state health system. Serbia's healthcare system is mostly public. So in this system are stored essentially by regulatory mandates, all referrals, all prescriptions, and all clinical notes for interactions with patients. In Serbia, all of the GPs are employees, other than a few private ones, are employees of the state health system. So the software was given to them to use for free as part of like a state procurement, and many do. Some of them still have private software that they have paid for themselves, and that integrates with the system to provide the referrals, the prescriptions, and clinical interactions into the backbone. There was one very interesting workflow step in this that was also delivered. When a doctor, a GP or a specialist, or family doctor or specialist makes a referral, they have the opportunity to book this referral immediately. So there is a directory of clinical availability throughout the entire health system, visible inside the interface and provided by the tool. This is Katarzyna, you were talking about hard evidence. This is a particular workflow step that sometimes was met with skepticism, but we can prove, and I've got some information on the slide later on, how effective this can be to basically reduce barriers to accessing healthcare and remove some of the accidental inefficiencies that arise. And I compare this with our experience in Australia, where a doctor hands you a piece of paper, a referral, and says, go figure this out and come back to me. And 15% of referrals are never actioned by patients, for example. So I won't go through the statistics here, but the deployment is pretty sizable as a single system. We get about 50,000 users a day. And the most interesting thing, I think, is there are 8 million API calls a day, roughly 1 per citizen of the country, interestingly, that come from these integrated systems. So that's what was put in. And now I will go on and kind of answer some of the questions, Tino, from the thank you. Please excuse the humorous image, but it really did feel a bit like that at the beginning of this thing. So some of the lessons and some of the things that I can share about how this deployment went. We call it small but complete. So one major clinical center, like a big tertiary hospital, was the first one to be onboarded and provided the referral endpoint for thousands of doctors in its region. And that I think was part of the reason that this went so quickly. Everybody immediately had value from using the system because they could book in their patient and actually complete the kind of the cycle of managing their care. So you're with a GP and they say, all right, you need to see a nephrologist. So I'll make that referral and I'll book that in for next Wednesday. You're going to need some ultrasound before you go see that person. I'll put that referral in as well and book that for next Monday. It's possible to automate such pathways as well. We've actually started some of that work with them. I love that nephrology example for that reason, because you always need 2 referrals and a pathology referral, right? But the interesting part was by providing a place where at least every action would lead to some outcome, this led to very rapid buy-in from the GPs. From the hospital's perspective and the hospital users, this also added value because they were no longer dealing with phone calls, processing paper, scanning stuff into a legacy system. You know, everybody immediately had some benefit from the digital health, solution as it was coming in. From a deployment perspective, there is no substitute for being on the ground. So we did this train the trainer model. One thing that was interesting and a bit different to how we've worked elsewhere, and I think this was a very effective thing. Hospital IT and clinic IT teams were engaged. So some of these were often very low level. You know, their main responsibility was making sure that the computer stayed on and the network was running. But we engaged them to essentially become administrators for their facility of the system, together with the more traditional clinic administrator roles. And this produced really good buy-in because they had a tool that they could own. Being more technical, they had better grasp of software. Sometimes, particularly with older clinicians, just technical kind of, how do I put it? Just skill with the computer basically can be an obstacle to proper digital health uptake. That barrier is getting much less, globally. And when we did the training, everybody did something in the system. So everybody got a chance to actually use it. The other thing that was very important was we call them cheat sheets. I don't know if that's a commonly used term around Europe, but just like a little one-page card that says, this is how to make a referral. Click here, click there, click there. You know, no fancy stuff. There's a little manual if you want more options. Another thing that I think was extremely important to this, and maybe Tino, go to the next slide. I'll kind of talk about it as we go. The tool was extremely basic in its first iteration. It did cover all of the essential functions: take clinical notes, send referrals, make prescriptions. All of these things were integrated with the relevant registers. So, for example, all of the prescribable medicines were pulled from the state, like the state pharmacy, kind of technical solution. So the data in the system was accurate, but there was nothing particularly fancy in it. Simple, fast, and provides immediate value are some of the kind of lessons from this deployment that enabled it to go so quickly. Something that was very important here from a stakeholder perspective, and this kind of ties back to my comment about showing some value immediately. You've got to manage to demonstrate why this digital health tool will be useful. And that's a personal experience. Sometimes you end up telling everybody a slightly different story because their world and their experience of delivering healthcare to people or managing healthcare is different. Something that's a bit interesting in the Balkans, and I think this is not so common around Europe, senior health administrators, like hospital directors, are practicing doctors. The Minister of Health is a practicing clinician, a surgeon. It gives them a very deep perspective on what happens. But actually, it meant that it was very, it was very easy, because the tool was useful, to show them what value they would have. I remember with one hospital administrator, they were very skeptical that the system would provide any value to their like a big tertiary facility. And our senior implementer sat down and said, look, how about I just put your diary in the system and show you what it's like to work in there tomorrow? And so they sat there like a shadow the whole day, just guiding the senior administrator while she saw patients. And she fell in love with the system in one day because it was simple, because it saves phone calls, it meant more time with the patient, that kind of thing. And of course, I believe our product is very good, but the reality is any kind of digital health tool that provides these sort of improvements, so long as it is relatively simple for clinicians to use, does provide value, and this can be communicated with stakeholders. Some other kind of lessons to this that I wanted to quickly touch on. There is a network effect, and this is something that you have to communicate to a stakeholder. When digital health tools start getting used, because they provide an instantaneous communication, because they provide some kind of feature to their users, this has to become visible to stakeholders. Very often, health, projects of any kind, not just digital health, have these checkpoints once a month, once every 3 months, and you prepare a report and you'll say, well, look, here's where we're up to. In Serbia, we provided a real-time view of what was going on. So you could go to a meeting and just say, here is literally where we're up to this morning. And that, I think that was extremely valuable. It's an underutilized feature of digital health tools. You have, in principle, once it's digital, you can have real-time access to everything. And this is a very powerful stakeholder engagement tool. That picture on the previous slide, I'll just put a link in the chat here, if anyone is interested. The picture on the previous slide is actually of a live dashboard of the operation of the system. So we set that up. It's not a particularly useful informatics tool, from a data science perspective, but it shows you in real time what's happening around the system. And that was a very effective way to tell stakeholders, it's getting use. This is where it's got a lot of use. This is where it's got less use, and so on. Tino, maybe jump to the next slide, and I shall conclude after this one. So the most important lessons that I think we learned from Serbia and how fast it went. We did not expect the project to take 6 months. We were planning a year or more, right? But the whole thing just went very quickly, and there was a network effect in it. Once enough clinicians are getting use from an integrated system, it is now of more benefit to the stragglers to come on board. So the most important lesson is when you go for such a large-scale project, it has to be shallow and wide. What I mean by that is, like I was saying, simple, small, iterative changes, and they have to be systemic, because if they are not, if you have one incredible digital hospital and no one can talk to it, it's very difficult for them to come in. And let's say that you have a perfectly digital part of the health ecosystem and one that is still using legacy tools. They can't go one thing at a time. They kind of have to engage with the whole system to get on board the digital bus. And this can be a great challenge from a project and rollout perspective. Whereas if it's shallow, so in Serbia, basically, you could refer anybody for anything as a GP within the bounds of the available referrals. But there was just one mandated data point, which was an ICD-10 classified diagnosis. And we put into the system a little ICD-10 coding, like a search bar, so you could find the code for what you were looking for. That was it. You didn't even have to write notes, what the referral was about, just a diagnosis. Of course, everybody writes the standard notes for their referral. But what that meant was, it was not challenging. It was not saying, okay, there's so much we can do digitally. We're going to do it all in one place or all in every place. It's too hard. Once you make the barrier to starting too high, it greatly blows out the timeline of a project and reduces adoption. By making it, like I say, shallow and broad, very simple, and get everybody to use it. Once everybody is all of the relevant folks for maybe a smaller digital health adoption, once everybody is using a common set of tools, you can build layers onto these tools. We started with this simple referral. Now there are rules for some referrals. Now there are extra forms that people fill in. But they are very, very simple changes to roll out across the system because everybody is on the backbone. And maybe the last kind of key lesson here is even pilots should provide immediate benefits. This kind of goes back to what Katarzyna was saying before. You've got to show some value to stakeholders, or you'll lose them, stakeholders and users. And maybe the last couple of things I want to say, I just want to touch again on IT support. Healthcare facilities always have some kind of technical support and administration. And sometimes they are the enemies of digital health projects because they've kind of been thrust upon them. By engaging them and bringing them into the tent and saying, look, this is now a system that you get to own and be of even more value inside your facility with it, not just someone who plugs the cables in. We got great buy-in. We got great support from these people. And to this day, they're an essential part of the ecosystem for the software, not just the hardware and kind of the account setup that they used to do. So in closing, on talking about real benefits, this graph is actually from Macedonia, not from Serbia. This shows what happens when such a large-scale deployment becomes systemic. So this is showing 4 years of data from Macedonia from 2013 to 2017. And those blue spots are the average daily appointments in the system, delivered through the system, just aggregated to weeks, because otherwise it would be too noisy. And you can see that the net number of appointments rises. This does not reflect greater adoption. Adoption hit 100% about midway through 2012. The system literally delivers more care just because it connects doctors together and reduces waiting times and waste throughout the system. That orange line is the average number of days that Macedonian appointments take to find a booking. And as you can see, it trends down over time. A bizarre fact about Macedonia, which otherwise, or North Macedonia, sorry, I always forget we have changed the name of the country for marketing purposes. The average number of days patients wait for care, it used to be weeks or months, right? Standard waiting lists. Macedonia is poor. It has less doctors and nurses than most countries in Europe. But whatever you need, on average, you will get it the next day. Because somewhere in the country, of course, not everybody goes the next day. They might wait for some appointment locally if they can't travel. But somewhere in the country, someone is probably free tomorrow. And a lot of people will drive 30 minutes or an hour to get seen tomorrow by the relevant type of specialist. I might stop there. I can see there were some questions in the chat. Tino, do you want me to answer them like this, or shall I just type some responses so that we can go on? I'm not sure how much time I've taken.
Well, we will take them now in the panel. So please hold the questions for a second, and we will continue with the next presentation. Thank you, Dalibor, because you are touching points that also Katarzyna raised about how to show value, and you provide practical approaches to a scale up based on effective pilots, I would say. So thank you for all your knowledge that is valuable for us. So now, after Dalibor's presentation, we wanted to hear from the smallest digital health companies, startups, or small and medium enterprises. And for this, I would like to invite Rita Campos for her presentation. Let me see here. This one.
Hi, good afternoon, everyone. This may be challenging, Tino, because I have some animations, but let's see.
Yeah, okay.
We'll do our best. Okay, so thank you to the previous speakers, because I think it all aligns very well, and it's very interesting to see that some of the challenges are actually the same, of course, in a different scale, but you've both raised points that are really key to the success. So we have been working a lot with startups, and I myself have been involved with startups working in data-driven solutions and artificial intelligence solutions for healthcare, so digital health solutions. So Tino, you can go to the next one. So I will try to cover, I mean, very, very briefly, please, some barriers that the startups are facing, particularly in Europe. So next slide, please. I've kind of grouped these or identified 3 areas. So the first one is how to validate solutions. How can a small company, a startup that has an idea, develops an app or something like that, can validate their solutions? And then there's definitely a huge area of legislation and regulation, and I even saw some questions already in the chat about that. And then we will talk a little bit about the fragmented market, which is both a beautiful thing in Europe, but also a challenge for startups or for companies wanting to scale. So starting from validation solutions, which is kind of testing or how to take it from the inside out. Next slide, please. Testing starts with internal testing, of course. So there's testing if we're talking about a software solution or even a sensor or a kind of device. So we start from there. Then we can consider there's a pilot, a first piloting, pardon the icon, to provide users the access to these, and then do potential clinical studies so that we gather data and we see who is using the solution, how it can benefit and evolve the solution to be more robust and grow. The next one, please. So in these areas, some of the key aspects that need to be considered, and one of them was raised by the two previous speakers. So one of the things that is different, or they may be different in healthcare and in digital health, is that the variety of stakeholders involved is huge. And sometimes startups confuse or mix customers with users. So one thing or one stakeholder could be the stakeholder that is buying or paying for the product, and others could be users, and these often are different. So you need to understand who are the users of the companies need to understand who are the users of the application. Are they patients, healthy people, doctors? And then in addition to those, already mentioned today, you have the IT departments of hospitals, and these are usually very focused towards infrastructure, security, and there are a lot of technical challenges to consider as well. You will have the administration, and these groups of people speak very, very different languages and see technology in a very different way. So if we are talking about a startup coming from the IT area with no medical background, you need to adjust and understand that these two communities speak very different languages. And this was actually one of the huge barriers faced during COVID. And some of my experience comes from coordinating a project during COVID, accelerating some of the startups, of how technology companies can really support so that clinicians, for example, see the technology as a support and not as a burden on top. I've heard doctors say, I cannot spend more time in front of a computer than with my patients, and the technology should be here to support me and help me, not add more tasks to my to-do list. So this dialogue is very important. And it's interesting that we have seen some progression that several universities and stakeholders in Europe and around the world are creating these postgraduate studies or executive education regarding AI for health, already involving both communities. And this is a very positive step. So know your users, know all the stakeholders involved, and understand how to relate with them, and then involve them from the beginning. As we were saying, nobody will use an app or software that is really not useful or friendly or not supportive. So don't assume you know how a clinician will do their job. Ask them and involve them in these. The chances of reaching something with potential are much higher. And then, as everyone can understand, the health domain is very sensitive. So a solution needs to be robust, secure, safe. So testing starts as an inside job, has to be done very accurately, very carefully planned, both functionally and non-functionally. So companies need to take these into account. So it's not like programming a non-critical, if you want, application. So we're talking about health. So there are a series of steps that need to be taken, and startups need to consider this as well. And then you start validating, or you look for the first pilot, the first group of users that will, in fact, use your solution and test it. And this is a major milestone. Again, selecting the stakeholders carefully. Is this applicable to a hospital, to a clinic, to a group of healthy people? So selecting the environment, the scenario to be used is very important. Have the stakeholders co-design the study with you. If there are clinicians involved, is the solution used for diagnosis, for report, for recovery? In how how is the solution integrated into the clinical process so that these make sense for everyone involved. And then if you're doing a study, you would require the approval from an ethics committee, from the hospital, university, whoever is involved. And there is a protocol to be written, a research protocol. So you need support here as well, again, from the clinicians or from other institutions that can help you validate these. But this is then the starting point. And then what happens afterwards, if you have this first group of people using, you of course receive feedback, companies receive feedback, be open to this feedback, and then how can you move forward? So the next slide, please. So once you have this first feedback and you reach a solution that has positive feedback, then you need to tell the world about it. So really invest in professional communication, because we like to hear success stories from our peers. So clinicians will listen to stories told by other clinicians saying, we use these and it really helps. We use these and we really don't like it, or that solution or that application. So we relate to our peers. So once you have these, invest in professional communication to showcase your results to other potential customers. So that is also very important. The next one, please. Then we go into legislation and regulation, which is a huge field, of course, and more so in health. The next slide, Tino. And here, some of the main hurdles that we've seen with startups is the medical device regulation, so MDR. There are a lot of companies that still don't understand the regulation, think it's complicated, think they fall outside because it's just software, which is also not true. So you need to invest in understanding and interpreting MDR so that you know where your solution is placed, of course. If you are applying then to get approved, contact notifying bodies, know where they are. And then we have GDPR in Europe, another very large consideration that needs to happen, and that will for sure need to be considered when developing your application, the kind of data that you will be collecting, anonymization, protocols, security, and so on. And somebody mentioned also on chat, we have now the EU AI Act, something that needs to be considered as well. If the solution, for example, is using facial recognition, there's also an act dedicated specifically to biometrics using facial recognition. So a company needs to at least be aware of the landscape, and this is important. And then if we go deeper into the healthcare, of course, we have different regulations locally, regionally, and nationally that can be applied. During COVID, for example, reimbursement paths were also a big issue and different from country to country. So this can impact as well the development of the solution and needs to be considered. Tino, you can click. One of the things that is important, so I give just an example, this project that I coordinated where I participated, COVIDx, developed, for example, an anonymization guide to support startups, which includes some checklists and some ideas on security and anonymization protocols. So there are some resources out there. The next, Tino, but the most important thing I would say is seek external support. I believe if the company is a startup, they should focus on what they do best, the technology part, and then look outside for supporting, interpreting the MDR, in applying for notification and standardization, in interpreting the GDPR, and making sure that the solution is complying with everything. So it's very important to feel safe. And then Europe is a very fragmented market. It is kind of a small continent in area, but we speak very different languages. We have different legislation. Of course, we have the European, if we are talking about European Union, there is some common legislation, but then it is implemented differently. There are a lot of regulations. The culture and context are different. The previous speaker also pointed out, so don't assume that because it's done in a certain way in a country, it is done in a different country. So things and customs are different, people operating in a different way. And this is challenging if you are developing and selling a solution in one country and you want to scale up to the next country that you think it's just outside, it's just next door, but it can be very, very different. And if you want the solution to resonate with people or the users, the stakeholders, then you need to be aware of this. And then on technical On the technical side, there are also a lot of issues regarding interoperability, how you connect with other solutions, because your solution is not an island, right? So it will eventually need to exchange information. So about security and data connection, data models, and so on. So there's a lot to consider when we are talking about so many countries in this specific space. Next, Tino. Again, what can be done? Be aware of standards and data models that are existing. Try to establish the use of these as kind of a quality seal for your solution, so that you know you are adhering to relevant standards. And the next, and network. It's very important, even for startups and SMEs. Again, don't see your solution as an island, and don't see the whole world as competitors. There's a lot of there's a lot of strength in numbers, and you can connect to other applications. You can collaborate with other companies that will help you penetrate other markets or other countries. So this is very, very important. Again, look for external advice in specific areas, even for communication. So don't try to do everything by yourself, because as they say, if you really go further away, go together. So build a team and collaborate with other companies. The next. So just to conclude, some takeaways from these that we would like you to have. Again, focus on what you do best. If your company is developing a specific solution to support diagnosis using images, for example, focus on that. Don't try to be an expert in MDR or in GDPR or something else. Do what you do best. So learn to communicate. This is also a very big struggle with technical companies. And I'm from the technical background, okay? I started my career as a programmer, but we geeks have sometimes a lot of difficulty in talking to people who are not from the same background. And that's fine, but then do invest in somebody to do that for you, to help you communicate your solution to the different stakeholders that are involved, the ones that use the solution, the ones that will pay for it, the ones that will maintain it or integrate it with other systems. So all of those are important. So seek for external support, not only for that, but for legislation or whatever you think you may need. And then, as I was saying, so stop, let's try to turn some of the competition into collaboration. I've had experience where startups partner to go to different countries together and even try to integrate the solutions into a larger bundle to offer to the same customers. And they were, for example, from different countries, and so they kind of connected the customer base and went together to these two countries. So the network is very, very important. And just some examples of some solutions in addition to what was already presented in the beginning by Marc and by Tino as well, very importantly. So one of the actors or stakeholders that is sometimes not thought by all startups are digital innovation hubs. So there's this large network built by the Commission or sponsored by the Commission of stakeholders that are one-stop shop to support companies. So what digital innovation hubs do, they connect dots between a company, a startup, and whatever support you may need. So they can introduce you to someone who could support you in the standardization process, or that could support you in elaborating data models or in legislation. So use the digital innovation hubs as facilitators for these. They can help you with training, with communication. They can introduce you to even stakeholders, potential customers. So use this network as to add value and as a support for your plans. Then I mentioned this European project, COVID-X was an accelerator. So it funded through the Commission 29 AI data-driven solutions for COVID, to support COVID. But it produced some interesting material to support the startups in terms of anonymization, GDPR, and MDR compliance. So there may be some interesting material there. I mentioned a couple of slides before this quality seal. The project label to enable is promoting this quality label for health apps. It's a very interesting idea of having this label that would kind of certify or tell the world that you are complying with some quality level. And this is a very, very interesting idea that even if your company is not known, it's not a scale up, it's not a large company, you could have this framework of reference that will kind of level the playing field for a lot of companies. And then digital health uptake. So some of it was already presented by Tino, and I mentioned networking. So the radar is an amazing tool where you can see a lot of information. You can discover what is being done in Europe regarding digital health innovations. So you can use that to discover potential collaborators that would strengthen your solution, and of course register in the radar and put your solution out there using the radar from Digital Health Uptake. It's a really good tool to put the solution out there to be seen by relevant stakeholders in health. And then of course the F6S platform. So it is one of the largest communities of startups in the world, and it provides some services for free services for startups, and provides information on access for funding opportunities, public and private. So not only through European funded projects, but also innovation programs run all over the world by large corporations. So this would be my kind of tips for today, in addition to what was already presented for startups doing digital health solutions. Thank you so much.
Thank you very much, Rita, and thank you for bringing not tools, but shops of tools. So we have plenty of materials to explore now, and also how well it connects with the previous presentations. So you raised that some questions were coming up through the chat. I would like now to start the panel, so I will stop sharing and all presenters with cameras on, and I would like to ask Diane if you can help me, because I was unable to see the questions that were coming. So if you can bundle them in some way, or just directly one by one addressing.
Right. Thanks very much, Tino. What I won't cover is the questions that came to you and Marc specifically. I'll transmit them later when we talk. But nevertheless, thanks to Rita mentioning the medical devices regulation, we have a question that goes to Katarzyna, and it was whether you yourself in Philips, Katarzyna, whether there were any implications for you of using the European medical device regulation, and indeed anything to do with the AI Act. And maybe afterwards Dalibor has got reflections on that as well. Following that, I will then ask some questions that went to Dalibor directly.
Yes, so let me start. And of course, MDR, that's one regulation, AI Act, it's another one, but there are many more that are coming into play in the digital health and especially AI space. And I think the implications are for the whole industry. So what we see right now, and again, going back a little bit into the hype, because this is where all of this is coming from. So we observe a lot of AI hype. We observe a lot of uncertainties. We see many different key opinion leaders from, many different companies calling to stop AI, or to slow down the development of AI. And we have all these discussions which are leading the regulators not only in European Union, but also in other countries, to really overproduce the regulations to try to kind of keep AI in healthcare and outside of healthcare under control. So I would say, yes, there are implications of MDR, of AI Acts, and also of many other regulations that are on the plate of EU right now. And we have to learn how to deal with them, and also how to be compliant and how to provide, enough evidence that the digital health that we are working on is safe and we can trust it and it's not a black box. So big implications for the whole industry, definitely.
I see both Dalibor and Rita nodding their heads. So maybe we take Dalibor first and Rita, if you'd like to add something, because I know you have thoughts on it.
I don't have too much to add. I mean, we are so head down in the delivery, but I fully agree with these points that have been that have been made. This is this is very necessary.
Yeah, it's very challenging. I don't think this is a train that anyone will stop. So I think AI is here to stay, and so I agree with Katarzyna. We'll somehow have to learn to deal with it. It is challenging. For example, regarding startups and data and AI, this experience from COVID-X, we were supporting startups in defining even intellectual property. And that alone is challenging, because when they have an AI model that is strengthened by the use of data and the data is not theirs, the lines are very fuzzy. So they start with a model, but then they train the model with data from a third party. And then they give the data back, but the model is improved or increased by the data from externals. So it is challenging from them in defining the IPR, and it is challenging to define the whole chain of processing the data and anonymizing it. I think there will still be a lot of discussions around these, but I don't think it's a train that anyone will be able to stop. I think it's also that the Commission is invested now, which I think is a great thing, in talking and investing a lot in prevention more than just treatment of disease. And that's where personalization also plays a very big role in AI. So it is also kind of, it involves stakeholders. It can be still covered by the MDR, by the way, because it's personalized individual recommendation. So it doesn't, even if a doctor or a clinician is not used, it can still fall within the regulation. But it is a very large challenge indeed.
I will say only this to add to these points. And years ago, I was on a panel where a number of startups, this panel was in Ireland, were complaining about the GDPR regulation. And I said, of all the private companies here, we love this regulation because there has to be a rule. It is nuts for patients not to be protected and to just have some kind of chaotic, completely free situation. Inevitably, something will be put in place. Put it in place faster and maybe make it too heavy. It can be reduced over time. If we do nothing, then there is chaos that can be hard to stop. So all I will say in closing is, good rules, even if they're excessive, fast but clear, would be so nice to have, because then everybody is playing by the rules. And I think uncertainty about regulation actually inhibits investment, and startups might be willing to take a crazy risk on something that could then be become illegal 6 months later. It's happened before. But I think you actually stimulate innovation by making the rules very clear and transparent.
Yes, I think this is very important, Dalibor, that regulations are needed. I absolutely agree with that. What we have to make sure is that it's clear, especially for startups, where they have to be compliant, what type of regulations they have to address. Otherwise, I know that we have to contain kind of the AI kind of hype But the thing is that if you start regulating too much and it's not streamlined properly and it's not clear enough, then it can also harm the innovation. So this is what I think has to be taken into consideration also by the European Commission.
Yeah, clarity is vital.
Yes.
Lots of good feedback there, Tino. Do we have time to pass on to another set of questions that would be around process and change management? Good. And meanwhile, while I pose the question, I would say to people, keep looking in the chat, because our colleague Jai Ganesh in particular is offering lots of useful documentation and materials there. So lots of food for thought. There were a number of questions that I'm going to roll up into one posed by Marc Lange, and that relates really to process in terms of, are quick wins enough, or do we need additional activities, including good incentives? And I guess there it's whether the incentives are, I know, moral, behavioral, social, financial, or simply business incentive.
You mind if I jump on that one? Because I think it ties to some of the questions that were asked about the presentation on Serbia. The quick wins should be the incentive. And, you know, what I mean by that is, at least this was the experience in Serbia. We made some basic stuff easier enough relative to the environment they were in. You know, sometimes you cannot make enough of an improvement, right? Especially where there are some good enough solutions in place. But you know this old joke, you know, good enough is the enemy of perfect. So from this perspective, I think there are two types of incentive, and this is what we've seen in various markets. In Serbia, third parties had to integrate with the new national backbone, and they just paid them, right? Money is the easiest incentive in the world, so they just straight up paid them. But for GPs, the incentive was, you've got better software for free. So on the one hand, it costs you to change. But on the other hand, the experience you're getting is so much better to what you were getting previously, also for free, that it became a powerful motivator. Ultimately, I think one of the things, it also depends on the roles in the system, right? But clinicians with the world over are time poor, extremely time poor. And an incentive that is, you will get some of your day back, or that you'll waste less of it. You know, I asked one of my, he was actually treating me at the time, a doctor in Australia. I said, you know, when you're in the hospital, he was in the hospital 2 days a week and private practice 3 days a week, in like a walk-in clinic. I said, when you're at the hospital, where does your day go? I was just curious, right? And he said, Dalibor, honestly, I reckon a third of my day is walking somewhere to find some piece of information, some piece of paper. Someone knows what was just done with that patient over there that I'm trying to treat, and I got to walk and walk and walk and walk. He was very fit, but one could not help but feel maybe there's a better way than this, you know, walking everywhere. So I think that incentive that says you will get some of your life back, and this applies across the sector, right? In the private sector, you have well-paid clinicians, at least again in Australia and to a degree in Macedonia and Serbia and other places we operate. You've got people who make plenty of money. The challenge in their lives is finding time to spend it. In public practice, if you give them back time, it just reduces the stress on the whole system. And, you know, there's getting back time so you can spend it on quality activities like being with your patients. And there's getting back time just so that you're not spending it on crap, you know, like that fetching a piece of paper. I have to go to the archive room on the other side of the hospital or the ward to find out something about this patient's history, or send someone else to do it, which is almost as bad. You know, that for me, you know, we talk about AI and fancy stuff in the future. There is just straight up basic workaday improvements that on their own, if you sell it right to the doctor, you know, I'm not talking about sales in a financial context. You have to explain to clinicians and you know, teams what the digital health thing means. They all care about clinical outcomes, but clinical outcomes are improved by efficiency. And digital health, above all, improves efficiency. Sorry, I talked a little bit long there, but that's kind of my take on all of this. So to succinctly answer it the way Marc posed it, you do need additional incentives, absolutely, but you have to tie them to the quick wins. You can't say, trust the process, 2 years from now, everything will be better. It's a broken contract.
I think you're raising very valid points, Dalibor, but it also is, connected to what Rita mentioned, what, this kind of human-centered design, understanding who is actually your user, who is just going to pay for something. But, if you include your user early in the development of digital health, then it's also easier for you to understand the way those people think, the things they are struggling with. And then, of course, we can talk about different types of incentives, right? From having free time to monetization. But you just have to have this user in the center of what you're working on. And then it's just easier to understand how your offering actually fits into what their needs are. So I think it's extremely important.
So have any of you experienced, particularly from general practitioners and the general practices, resistance to change and real difficulties there, or has it always been smooth? That's implicitly a question from Esther Kovacs. Katja, you're smiling.
Yes, I think that's one of the also a big challenge for digital health acceleration acceptance. We always talk about the clinicians kind of wall. You have to change the mind shift. You have to change the mind of people. They have to really understand what is the added value. We also, heard in the past in the hospitals, for example, if you will come back with one additional dashboard that I have to connect to, I will just run away. It's not about the solution. It's how you make sure that the work of clinicians, of GPs, is just easier. And that's how you keep the retention to the solutions that you are actually offering. Otherwise, they will try something. Even if you provide money, they will try new software, they will try new solution, but then they will very quickly stop using it because it will just not fit into the overall workflow they have. So I think the change management, indeed, change in the way of thinking, very clear communication, also support from the peers, it's extremely important.
And
I might connect to that. Oh, sorry.
Well, maybe just to throw in one last question, because I'm sure Tino is going to be on my back any minute. These collaborative ecosystems that you've all been aiming for so ambitiously and so dedicatedly, are they self-organizing? i.e., do they just happen? Or what do you actually need to get in place to get ecosystems to collaborate? I know it's a big philosophical question for debate, but any quick answers?
I think the ecosystems are just different. You have some of them that are happening just naturally. You have some of them that really have to be forced. You have some of them that even the third parties, like let's say the government, have to force. Like we know the situation in US where the government was really pushing on the EMR systems to open up the data to other companies. So it really, really depends from ecosystem to ecosystem.
And the thing I will add to that is particularly the subject of it being forced, because people are so time poor, other than the usual conferences and places that these things happen, the finding where there are natural ecosystems and encouraging them is something that ministries could stand to do a lot better. Often you get some review panel that spends 2 years coming up with something. And they're like, all right, what we need is a new institution or a new group that's going to add even more time to people. Find out where doctors are already doing things, or where, you know, the health ecosystem is already thriving, and just encourage this, because local conditions can differ very wildly. You know, enhancing what is working is often a better way to get an outcome than trying to redesign it. And I say this even though essentially redesigning clinical process and digitizing it turned out to be the best thing that happened in Serbia. But you know, I don't think that's always the right way. That was a pretty specific reform and a very large one. Diane, just because there were some specific questions for me, I'm just going to drop them in the chat here. Even if the call ends, I think that they will still be accessible in people's teams so they could see the responses. Is that all right?
I think that's a great idea, and much of what you've said verbally, Dalibor, relates to incentives one way or another. Anna, before we hand over to Tino, any last thoughts on that question?
Yeah, just to say that I totally agree. So quite often we don't need another very high level group to study everything. And these network or integration. So I would take any small win. It's about talking with the stakeholders really involved. And related to that, one thing that we see is that everyone wants to deliver the next big thing. So everyone wants to deliver the next big software or greatest solution. But sometimes we need very tiny integrating pieces that connect what already exists in the ecosystem. I've seen a hospital, for example, where they have amazing software, but there are nurses who spend half an hour opening PDFs and copying values to a dashboard. So this makes no sense. Of course, it's not appealing to say, yeah, my solution reads PDFs and inserts into a database, but it is what they need. And if they would have that, they would cut out half an hour in the process. So sometimes we're not missing the largest stone. We are missing the little piece that would make the whole thing kind of glued together. And that is, of course, not always the most commercially solution, but it is very needed as well.
Thank you. Over to you, Tina.
Yeah, thank you very much, Diane, and thank you all three presenters for this rich conversation. Now it's time to wrap up, and I want to invite Michael Strübin from Digital Europe to provide us with his takeaways and next steps. So I will share the screen, Michael, and welcome for the closing.
Thank you. I think we're a couple of minutes. We have very little time, so I think I'm going to spare you guys a major wrap up. I think many things have been mentioned. I think the fragmentation of the market, difficulty to scale. One thing perhaps that all the speakers probably skirted around, which is that yes, of course you need to know your user, but you also need to know where your customer is, who pays ultimately for your digital health innovation. And I think there too we're looking here at a multitude of reimbursement systems where I think from an industry perspective, from a supply side perspective, we just have to ask policymakers to work more together, align your requirements, accept evidence from other countries, don't move away from this don't invent it here syndrome, because if there's one thing that SMEs and large companies really always struggle with in Europe is scaling, deploying one solution in one country and then moving it to another solution, moving it to another country. That is, I think, where famously in Europe we're still falling short. And with that, I think thank you very much for all the speakers. This has been great. And this has been a very rich conversation. I just want to close with two calls from DHU, which is one, of course, Marc has already mentioned it. The call for twinnings has been extended until the 13th of October. Do use this opportunity to go to another country, learn from another region how they deployed their solution. Go to Serbia and take a look at Dalibor's solution, or go to the Netherlands. I think Philips has plenty of deployments there, or go to one of the many deployments from SMEs all all over the place. The other thing, I think it's also been mentioned, the radar. This is a great opportunity to raise the visibility of your solution. Check it out, because that is also a repository of good practices from all over Europe that is supposed to stay, that is here to stay. And here's an opportunity to advertise yourself and get the attention of everybody out there, including future customers and payers. And with that, thank you so much. Thanks for staying a little bit extra, and stay tuned and get involved. We'll be sharing a recording of this very soon, and there will also be a follow-up email, I suspect. Thank you so much.
Thanks
you very
much to everyone.
And thanks again, EHTEL, for organizing.